Hi, I'm Dr. Evan Mountford, and today I'm going to teach you about this. You might have seen this for your kids at school. Many people use them for balance and coordination at the gym. Here at the office, we use it to rehabilitate your lower back. They're called wobble cushions, one of my very favorite exercises for pretty much every single patient. First thing you'll want to do is get one of these from Amazon or some other location. They're not too expensive. They range between $20 to $30. To do this exercise, well, first of all, the benefits of the exercise is a lot of us have immobilized lower backs from sitting almost all day sometimes. And the motion is life. When you decrease the motion in your lower back, you're decreasing the nutrition that's pumped into the discs. That increases lower back pain and causes an increase in your degenerative changes in your lower back, throughout your spine, really. So what I try to do is give patients these exercises that will help them to be able to counteract the stresses of daily life. And this is one of them. This paired with the cervical traction exercise are the two exercises I recommend for almost every single patient I have to be able to help them to maintain their spinal health and prevent spinal degeneration by pumping nutrition into those discs. The discs don't get a blood supply, they're avascular. The vertebra above and below have a great blood supply, but the only way that you can get the blood into the disc is by movement. And that movement will help prevent disc decay. And the reason why that's important to your health is because it's not just an issue with pain. Most people recognize that pain is not the real problem. Pain is just like an alarm that goes off, a fire alarm or a check engine light. It's your body telling you something's really wrong and you need to pay attention to it. And if you don't pay attention to it, health consequences arise. And in fact, you have to lose about 40% normal function before you start to feel pain. And so in order for you to be able to really be proactive about your health, you can't just use pain as an indicator. And that's why I recommend this and other exercises preventatively to help your spine. So let's go through the wobble cushion exercise. The axis of rotation for this wobble cushion is around the size of your disc in your lower back, which is why we recommend that you use this versus like an exercise ball or just sitting on the seat. Of course, any movement is good, but I do recommend it. It's an inexpensive piece of equipment. Why not get it? So there's three exercises that we recommend in all three planes of motion. They're called the coronal plane, the sagittal plane, and the transverse plane. And so this is one of the three that we recommend, which is curling your back out as you're rolling your hips back, kind of collapsing yourself down. A common mistake is for people to do this. That's still going to initiate motion. However, when you bend down this way, that actually is going to put your lower back in danger because as you do that, the lower back curve is flattening out. It's supposed to be curved this way. It's flattening out, and the vertebra can shift backwards. We call that a subluxation. If you already have one, which most people do, it would just make it worse. So the better thing to do is to roll out, tucking your chin a little bit, looking up like this, and then going at a pace that's about 1 to 2 seconds per motion, kind of like the music Staying Alive would be the goal. Most people can't go that fast at the beginning, either because they might have neck and lower back pain that prevents them from doing that, or might cause some dizziness. And so if you have any of those symptoms, go slower and smaller. And any sharp pain, consult your doctor, consult your chiropractor. That would be important to take some x-rays at that point. So this is the first exercise for a person that is younger and has a more mobile and limber spine. We recommend about 40 repetitions. That's 1, 2, 3, 4. For someone that is stiffer and has more arthritis, then we'd recommend more, 60 or more of those. The second one, and it doesn't matter what order, is to make a C shape out of your spine by dipping your hip one direction and then bringing your ear towards your hip on the other side, just like this, and making sure that your head and all these exercises is getting involved, because we want your neck to also get that nutrition, those discs to get the nutrition. Okay. The final one is to twist and look over the shoulder, both sides. This one can cause dizziness if you're not careful, and going side to side in a rapid pace like this is what the goal is. Some people will have to just keep their head in the middle just because it's just causes too much dizziness. So again, thank you for listening. I'm Dr. Evan Mountford at Loomis Lifecare. We are happy to help you if you just reach out.